Welcome to the Holistic Plastic Surgery Show, where we dive deep into the hottest trends in health, beauty, and cosmetic treatments. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Well, heart disease is the leading cause of death in the United States. 1 out of every 4 deaths every year are attributed to this deadly condition. Well, in our culture, we've been conditioned to blame heart attacks, hypertension, and coronary artery disease on genetics, or aging, or not seeing the doctor and taking the right medications. Well, that's all a load of hooey. Your heart disease is caused by not getting enough sleep, stressing too much, not exercising, and especially eating the wrong foods. And my next guest has made it his life's mission to show you how to prevent and reverse heart disease using holistic means. He's taken patients who are cardiac cripples, people who have had multiple bypass operations and have been told by their doctors that it's hopeless and to get their affairs in order. And he's completely reversed their heart disease so that they're climbing mountains not long later. And he does this using the power of food and lifestyle. He's the doctor Big Pharma hates, but you need to know. And I'd love for you to meet him. So let's get started. My guest this week is the director of the Kahn Center for Cardiac Longevity and a clinical professor of medicine at Wayne State University School of Medicine. He is passionate about prevention and reversal of America's #1 killer using natural strategies. He tours around the country, giving lectures to small and large groups about the heart-healthy benefits of a vegan diet. He's the author of several best-selling books, including his first book, The Whole Heart Solution, which is part of a national public TV special. His latest book, Vegan Sex, is the #1 bestseller on Amazon in its category. He is a frequent author on Mind Body Green and has spread his life-saving messages about the power of a plant-based diet on countless television shows, radio programs, and podcasts. He is the author of the Green Space Cafe in Ferndale, Michigan, the premier plant-based Whole Foods restaurant in Metro Detroit. Now, I've been there many times, and the food is like an explosion of flavors in your mouth. I'd like to welcome my good friend, America's healthy heart doc, Dr. Joel Kahn, to the Holistic Plastic Surgery Show.
Well, thank you so much for coming on the show. It's really a pleasure to have you on, and I think you've got so much great information to share with my audience today. I've been to a number of your talks, and I tell you, Joel, every time I listen to you, there's something new that I learn.
Well, thank you very much. And it's a very dynamic field, a very important field for all the people out there listening, because heart disease still remains #1. I talk about wrinkles inside the heart. So you and I are sharing an interest in beauty and health, internal and external. And we're going to make some good points for sure for the listeners.
So you're a very different type of cardiologist. I mean, most cardiologists, they spend their time performing cardiac catheterizations, angioplasty, doing these types of invasive procedures that can make them a lot of money. Now, I know you've done a lot of that in the past. You've done a ton of that, but you're now forging a very different path that most cardiologists don't take. You're traveling around the country, educating people about the benefits of a plant-based diet and lifestyle choices and how it can prevent and reverse heart disease. Can you explain how kind of your personal journey of how you went from being a kind of traditionally trained cardiologist to what you're doing now?
Absolutely. And, there's such a need in every field, medical doctors, nurses, practitioners, to both become students of this field and then become teachers of others. Because I tell you, the public wants to hear, how do I feel better? How do I avoid a medication? How do I get off medication? And for many, many, that's a potential there. I personally just got interested in nutrition around age 17, 18, which is when I was accepted in the University of Michigan in Ann Arbor to a combined undergraduate medical school program. And nutrition was really what set me apart from my peers. Although I did all the standard training to become a cardiologist and, as you said, expert in procedures and cath labs and kind of cardiology operation surgeries. But about 10 years ago, and you got to always give credit to the pioneers that preceded you. One of them would be a Dr. Dennis Burkitt, and very few people would know his name nowadays, an English physician who spent a lot of time in Africa. But he commented in the 1930s, he goes, the medical system is like a waterfall where people are falling over on the rocks, breaking their bones, and the medical system is excellent at getting an ambulance to pick them up out of the rocks, take them to the emergency room, and take care of them. But nobody's thinking about putting a fence around the waterfall so people don't fall off in the first place. And, after at that point, 10 years ago, more than 15, 20 years of practice and training, it was pretty obvious. I was helping a lot of people by putting stents and balloons and other procedures, but it wasn't at all impacting their overall physiology and chance of having it again, being in the emergency room, and even their very lifespan. And I decided to get more educated, and that's always a good choice. You're a student for life. I'm a student for life. And I found a university program to go back to and really have dived deep into what might be called integrative cardiology. Using all the standard tools, the Western tools, the medications, the operations when you need, but going back to the basics, food, stress, sleep, love, relations, fitness, and all those things are really the root causes. So some might call this functional medicine cardiology, root cause cardiology. What led you to be in my office complaining of chest pain with clogged arteries? And can we get not only an immediate fix, but can we kind of work at the root so that you can actually work to reverse it? Body will heal so many conditions if you just stop throwing insults at it over and over and over.
Exactly. And I think that's such an important point that really needs to be made. Now, for you and I, we understand what the term integrative medicine means, but a lot of people haven't heard of it, or maybe they've heard of it, they don't quite know what that really means. So can you describe what the term integrative medicine means, and also what the term for you of integrative cardiology means? Because that's what you call yourself also, as an integrative cardiologist.
Yeah, and I think, I am integrating all that I learned in medical school, residency, and afterwards, many conferences and such. So if you need to have a procedure, medication, it's going to be available to you. I haven't thrown the baby out with the bathwater. But there is an expanding scientific knowledge that certain herbs, certain supplements can work as well as prescription drugs without many of the side effects. It's gone from being kind of hocus pocus to now being quite well ingrained in our medical literature. And that's something I do in the office and see the results. You have to really be able to make tangible measurements and see people improve. And integrative goes beyond just medications and supplements, but looking at acupuncture, looking at grounding or earthing, if people are familiar, looking at trying to get at root causes of inflammation, really the basis of so many diseases. Is it an allergy to food? Is it an external skin disorder like psoriasis that we now know affects the entire body internally, not just externally? Sleep apnea. So we're integrating all that approach to look at the whole patient. And I may focus predominantly on the cardiovascular system, but I'm very often reaching into the liver for what's called fatty liver disease and working on that, or reaching into the gut and making sure that that's optimized. And just as you do, in terms of the biggest organ in the body, the skin, which my field says that the lining of arteries is the biggest organ in the body, and you probably would say the external lining of the body. So we can duke that out a bit, but they're both
That's all right.
They're both very important.
Well, and I think when you talk about integrative medicine, the idea that I try to explain to patients, because they say, okay, what acupuncture and stress reduction and yoga, what really does that have to do with medicine? And I think the way I describe it to patients is, okay, if you get sick, if you're acutely ill, you really need the medical system. I mean, that's what it's made for. But it's before you're ill and trying to stay healthy that it is so important to follow these types of things. And unfortunately, as you and I both know, Joel, the way that the healthcare system is built, it's not giving incentives to do research on those things, because it's built on big pharma. It's built on money and selling medications and selling drugs and selling procedures. You don't make a whole lot if you recommend somebody de-stress, get more sleep, and maybe do some yoga and exercise, although that is so incredibly important to keeping our health the way that it should be.
Yeah, I agree completely. And it's not only that the funding for research is at times inadequate for some of these softer, less sexy, older traditional approaches, but when it has been done, if there's no money in it, the research that's done, even if high quality, isn't taught. So just an example, you mentioned meditation, yoga. There was a study published in one of the best cardiology journals in the world in 2012, if you have a heart attack and you're taught meditation, or you have a heart attack and you get just standard post-heart attack care, there's a 48% reduction in the chance you're going to have another heart attack or be admitted to a hospital in the next 5 years if you're taught meditation after a heart attack. This was done with the highest of standards, and that's more powerful than any prescription drug a person takes after a heart attack. But if you went around the country today and looked in hospitals, how many heart attack survivors are taught that data, and there's actually a program to get it? It just doesn't exist. So that's what frustrates me, but that's also what powers my clinic, is being available to offer and educate and teach on, these are really powerful tools, and not only is a pill a powerful tool, but so is your pillow to sleep at night, and on and on.
So briefly, if somebody comes into your office and they say, Dr. Kahn, I was sent here by my family practice doc. I have angina. It's not unstable, so this isn't an acute situation where they're going to imminently have a heart attack. But let's say they do have angina that kind of comes and goes. They've been taking some nitro tablets to settle it down, and it works. They're eating kind of the SAD diet, the standard American diet. Maybe they exercise. They're kind of a weekend warrior, that type of thing. And I'm sure this is a type of situation to see a lot, where people are stressed. They're working their job. They may be a little bit overweight. They think that they're eating okay, but they've got this heart disease. What are some of the things that you recommend, just kind of basic recommendations that can make huge differences for them? Obviously, short of what a lot of cardiologists would do would be, hey, let's put you on a statin. Let's get, you on these medications, the antihypertensives, stuff like that. What do you do differently, and what would you recommend for this person before, once again, they've had these types of issues come up?
Yeah, sure. So in my clinic, I've arranged it so I have the luxury of having time to educate people. And that is something that's so necessary. And we can make that efficient using videos and online and printed resources, but I also have the time to do some head-to-head teaching. So first of all, I'm going to teach them that so many of these chronic diseases, you're asking me about heart disease, but we can talk about being overweight, having sleep apnea, having adult diabetes, that they are reversible. And that is not known to people who've been suffering from these conditions, that there's the possibility, I don't guarantee, but if they'll do the hard work, there's a possibility that heart disease can be turned around and start to reverse, as well as even lung diseases and diabetes and obesity and blood pressure and cholesterol. That there is this bright light at the end of the tunnel they didn't know about. Once I got them to understand that that's actually medical science, I'm going to go just a couple steps. I'm going to really ask them to watch something like Forks Over Knives, a very powerful documentary. They can watch at home. I carry multiple copies in my office, the DVDs, so they can walk out with an education. Insist that they watch it with a spouse or family or children. Get people involved and make them understand that, yeah, you can look at 10 pill bottles for the rest of your life, but you may be able to get yourself out of that rut. And that really gets people to buy in, and that's not hype. There are, just so many examples of life transformations that go on when you're willing to be open-minded and do the work. You've got to say, my old habits didn't work, looking at new ones. And then I'm really looking for small gains, unless they're really sick. I'm looking for really small gains. I really would like people to get off dairy, because that's so simple nowadays. And whether it's just the extra saturated fat, whether they have an undiagnosed lactose intolerance, whether they have an actual food allergy to dairy, there's no substance in the world of dairy that doesn't have a plant-based substitute nowadays. So I ask them that one simple thing. I actually ask people just to eat an apple a day, because for some people that will double the amount of fruits and vegetables that they're eating, that extra fiber, that extra magnesium, that extra antioxidant phytonutrients. Exactly. And I just want them to experiment with some meat substitute. There are so many bean burgers and other kind of ways that they can approach just a staple of the American diet. The burger at barbecues, the burger at picnics, the burger at work. And if they'll do those three steps, and when we go back over and talk about Forks Over Knives, talk about dairy substitutes, talk about there may be successful or maybe unsuccessful attempts, we got a basis to move further.
So we've got an image I'd like to show people here. If you're watching the video podcast, let me show you what this is. Now, this is a picture of a distal left, is it ascending artery?
Anterior descending.
Oh, left anterior descending. Yeah, shows. I know my cardiology so well. Back November 27th, 1996. And then on the right, you see very different, just under 3 years later. And so you can see on the left with the, there is actually quite a bit of stenosis, basically, that the artery, the blood flow going through it is much, much decreased, and then it's been opened up on the right side. Now, usually when you see this type of thing, it's because of placement of stents, angioplasty, those types of invasive procedures. What happened to this patient to improve the blood flow basically to the heart?
Yes, and that's a picture I have hanging in my office, and one that has motivated many people to understand the power of these lifestyle changes. But that was basically somebody enrolled in a program at the Cleveland Clinic Foundation under the guidance of Dr. Caldwell Esselstyn, very famous physician who was taught that it actually turns out that picture is a general surgeon who had a very badly narrowed artery and was having so much chest pain that he couldn't operate any longer. He was only about 52 years old, and he completely changed his diet to better stuff. Not only different, better stuff. Eating more salads, eating more bean casseroles, bean chilies, big bowls of oatmeal, whole wheat pancakes. But there were no animal products. There was no added oil. That's called the Esselstyn reversal diet. And it's available in books, and you can find much information on it online. And that would be, just one of the more dramatic examples. But the science says that we can anticipate that, even if you've had years and years of heart disease. So that's what I've been teaching patients really since about 1990, when the first solid scientific study by a Dr. Dean Ornish in San Francisco came out with much the same findings. Years and years of heart disease can improve in 3 weeks by taking the irritant away. And the irritant is usually animal meats, oils, and the dairy-related proteins you're going to find in cheeses and full-fat milks.
So what have you seen in some of your patients? I mean, one thing that I covered a few episodes ago, I interviewed Dr. Terry Walls, and her kind of miraculous change from being almost, being wheelchair-bound to just several months later, with her doing a change in her diet, being completely active and riding her bike. And she has seen a lot of changes in her practice similar to that. From your standpoint as a cardiologist, what are some things that you have seen that would surprise people listening who think, oh, okay, I mean, they know kind of what they read in the paper and stuff, but they haven't heard of Dr. Esselstyn, Dr. Dean Ornish, they haven't heard of you. What are some of the things that you guys have been able to do without putting people on these medications or undergoing these invasive procedures?
Yeah, the serious student who is striving for what one of my colleagues calls nutritional excellence. And I talk about be extreme in your diet, moderate in exercise, and abundant in love. Because if you really want to reverse a serious medical disorder, or at least have the potential to do it, like heart disease, like adult diabetes, like obesity, it's going to take some work. It's going to take some changes, but think about the benefits. And we know that the food can be amazing and delicious. So you can have people flunking stress tests, having angina pain, taking that little pill called nitroglycerin, and literally within 3 to 4 weeks, see those dramatically improve. Even their stress tests improve. You're not melting the blockages away like Drano, but you can change the blood flow. You can change the lining of arteries very quickly by feeding brightly colored fruits and vegetables, whole plants, legumes, lentils, chickpeas, and beans, and taking away what is the American tradition of eggs and bacon and biscuits and gravy and turkey cheese, hoagies, and all these things which do taste good because the food industry, you talked about big pharma. There's also big food, the food providers that know how to create delicious smelling, delicious mouthfeel, delicious flavored food that's subsidized by the government. So it's not even expensive, but it's very expensive on your health. So that will happen. There are, we have many people in my clinic and my colleagues that have lost over 100 pounds. They've done this without bariatric surgery. They've done it without a weight loss program. They've done it by watching Forks Over Knives, reading a book or two, and getting a few things in their home. They have brown rice. They have beans in cans or dried beans. They have a trip or two a week to the grocery store to get lots of either frozen or fresh fruits and vegetables. And they learn how to make 5 or 6 dishes they didn't make before. Very often a giant chili or a giant stew or a giant soup using a blender. I mean, simple step to make a very green, fiber-rich smoothie. People with certain, we call them autoimmune disorders, as you know. Great example of a psychiatrist in Minnesota, a friend of mine, Brooke Goldner, medical doctor, who at about age 15 developed full-blown lupus on a very powerful medication, immune modulating medication. And at about age 26, 27 was introduced to a plant-based, whole food, largely raw diet, and was off medication within less than a year, and now 10, 12 years later has never been on a medication. These are not just like religious testimonials. These are in the published literature. And even our government in the United States, Medicare, only reimburses for educating a heart patient on 2 styles of eating. Both are plant-based. One's called Ornish, one's called Pritikin. But they've looked at this data and they said, we're going to save money if we can have a hospital. And unfortunately, the programs are limited to under 100 in the United States, 1 in the state of Michigan, where you and I both are. But at least we have a few that, and they're covered by insurance, and there's no other dietary plan. So it's very hopeful that we can prevent and reverse chronic disease in a way that, you know, could have such a big impact in a short time. We got to get it to medical students. We got to get it in the hospitals, and it's growing. It's actually a very optimistic movement going on in our field.
So his name is Dr. Joel Kahn. His website is drjoelkahn.com. That's K-A-H-N, not K-H-A-N. And he is America's Healthy Heart Doc. We're talking about reversing heart disease. So one of the things I wanted to ask you that I find real interesting is what your opinion is do you think that it is, you know, as a practicing vegan, do you think that it is the addition of more of the good fruits and vegetables that's more important? Or do you think it's removing the animal-based protein and the animal-based, you know, the foods, the meats basically from your diet that is more important? Do you think
that's a really interesting question. And there actually is some data on that. And I'll just give a shout out if anybody wants to get more information. I'm going to refer you away from my website. Go log on to nutritionfacts.org, F-A-C-T-S. You get a free video a day for 4 or 5 minutes, and you can, in a few months, learn more than most medical doctors practicing in the community know about nutrition. So this topic was just covered. And the answer is it is actually more important to add fruits and vegetables. Okay. You'll have a win-win if you add fruits and vegetables and cut back on processed food, fried food, high meat, high cheese diets. But you can actually create an antidote. There's a classic study, I just lectured on this today, that you feed healthy volunteers a hospital hamburger. I mean, you'd think that would be good food. It's not. You feed a healthy volunteer a hospital hamburger, and you can measure that artery function deteriorates for 4 or 5 hours before it starts to recover. Because they're not healthy. They have, you know, a lot of saturated fat, salt, sugar. They actually have dead bacteria and on and on. But if you feed a person that same hospital hamburger with a big salad or with slices of avocado on the hamburger, you totally neutralize the harm. You don't create benefit. So I don't want anybody to think that's the solution. We still want to benefit the body, but you actually neutralize the damage. So any meal, an omelet with spinach and tomato is better than an omelet without. Any sandwich with lettuce and tomato or a side salad is better than that same sandwich. A pizza can be a foundation for an amazing amount of vegetables, but don't, you know, totally drown it with triple cheese ones. But yeah, so add in fruits and vegetables every step you can. A martini, it's the olives, baby. That's all that matters.
Okay, there's a quote from a doctor that I know you're colleagues with, Dr. Kim Williams. He is the past president, I think, of the American College of Cardiology. Right. And this quote is, there are 2 kinds of cardiologists, vegans and those who haven't read the data. Have you had, I mean, this is a strong statement to make. Yeah. Have you had pushback from other cardiologists who maybe don't feel it's either realistic what you're encouraging people to do, or maybe don't even agree with your message? Are there cardiologists out there who don't believe this, that they think that, once again, eating good amounts of meat and all that is actually okay and may even be beneficial?
Unfortunately, the medical community, I think, is very confused, and a lot of us feel that right now we're like cigarette smoking in the 70s, maybe the late 60s, when many people felt there already was enough data to put warning labels and restrict smoking in hospitals and workplaces. But it took 15 more years, and that we have all this data about the importance of food as medicine, of whole foods and plant-based foods and such, but we're still serving fried foods and processed foods, even in hospitals. We have Wendy's hospital and Wendy's restaurants in university hospitals. So, you know, that there's great confusion, and the confusion may be a plan to just delay the obvious that we have to totally change the way the USDA funds and subsidizes to make really foods that are harmful inexpensive and foods that are healthy currently more expensive, which is unfortunate. So yeah, do I get pushback? Sure I do, because of all this confusion. And physicians will tell a patient striving to move to a plant-based diet, you better add back protein, or God knows that if you're raising children this way, you'll hear it all the time. Where do you get, nobody cares about your diet till you tell them you're vegan, and then they become nutritionists and they're worried about your protein all of a sudden. I think they're, because they're really, and I know, you don't go to grand rounds very often to hear anything about education. You don't get the pharmaceutical rep come to your office tell you much about nutrition education.
Exactly.
And you really have to be a student on your own in the medical world, but more important, be your own health hero for all those listening, and get through a conversation like this and many other good, reliable resources. Yeah, I haven't had anybody egg me or tomato me, and I've been eating this way for 40 years. I've been vegan for 40 years, so this started in undergraduate long ago. And sometimes it's awkward, but now with apps, I can find restaurants all over the world. And with, Trader Joe and Whole Foods and online and big box stores, you pretty much can survive anywhere. But yes, it's still confusing to the medical world. And if you're not sure about that, go walk in a hospital cafeteria and you'll clearly see how confusing it seems to be. But I think we're really at that tipping point. Everybody knows it. You walk through an airport, you see better and different choices. You go to a steakhouse, you can see plant-based options that never existed before, and they actually sell very well. It's just providing options and being open-minded, and let alone, the real hardcore movement of great restaurants and great, food that's being created by the food industry. It's awesome.
And that's one of the things I admire about you, is that you practice what you preach. You really are out there trying to encourage people and institutions even to encourage their healthy behaviors in their patients. So one of the things you do is I know you have the website and a group where you're trying to encourage, especially our local hospitals, to stop feeding their patients such garbage. And so you'll take pictures of this huge tray of bacon that's being fed to patients who are cardiac patients. The Wendy's in the local hospital here, where I went to college, I actually volunteered at a hospital. This was in Kalamazoo, and they had a Pizza Hut at the actual hospital.
Yeah.
So same type of a thing. So you do that. I really admire that you've got your plant-based nutrition support group. Can you just briefly tell us how that came about? Because there's some, I've been to a couple of those meetings, and there are some incredible stories of people who have been cardiac cripples, and they've gone on a very strict plant-based vegan diet, and it's absolutely changed their lives. I mean, these are stories that most people don't hear about.
Yeah, I agree. And, there's a proverb that says, if you want to walk fast, walk alone. If you want to walk far, walk with somebody. And the power of social support, the power of friends, the power to share stories, whether it's AA, Overeaters Anonymous, whether it's, if anybody's familiar with Saddleback Church and Pastor Rick Warren, something called the Daniel Plan, where they built a total revolution of health in one of the largest churches in America, around little small groups of people getting together and sharing notes and processes. So about 3.5 years ago in Detroit, I got a phone call from a man that I didn't know who told me the story. He was a heart patient. He had done remarkably well by changing his diet consistent with the Cleveland Clinic program, Dr. Esselstyn, but wife, peers, coworkers, holidays, all these things were rather challenging. Could we make a support group of 10 or 20 or 25 people and just share the journey together, because it would be a better journey, more successful? I said, absolutely. First meeting for 25 people, 150 people showed up. Second meeting for now 150 people, 200 people showed up. This was in early 2014. And we knew there was a need out there that was far greater than we had thought, because this was without any funds or advertising. So fast forward now, plant-based nutrition support group.org, pbnsg.org, has about 3,800 members just in southeastern Michigan. It's totally voluntary, totally grassroots, but it's a place people know every 4 to 6 weeks. We're probably going to have some educational event, lecture, demo. Coming up pretty soon is the founder and CEO of Whole Foods, John Mackey. Pretty big fish. He's a vegan fish. He's a plant-based fish. Pretty big fish to grab to lecture, to a local nutrition group, but the numbers are so large that we've been able to do that. Really with, this was just it exists in every city. If we can get a couple core excited people together, they'll come out of the woodwork and say, I want to be around you. So it's been very good, and it's built on small groups around suburban Detroit. So if you don't like the 700 people amphitheater will fill with somebody like John Mackey or Dr. McDougall or Dr. Bernard, you can find 10 or 12 people in your neighborhood. And it's really changed lives, as you said. We've seen people, believe that they can take over control of their health, work with their doctor for sure. We're not radical, and we don't really treat people, but show them living examples all the time, and the medical science, that this is the most important decision you can make is self-care. Where you shop and how you move and how you sleep and how you manage stress. It's the single most important decision to, just recognize what as a medical doctor. I know that our bodies are just miraculous. And when they're working well, we take it for granted, but it still fascinates me every day, all these crazy parts working together, and get out of bed is a miracle.
So if you're watching or you're listening today on the audio or the video podcast, and let's say you live near Metro Detroit, Southwest Michigan, would strongly encourage you, take a look. If you're interested in the vegan lifestyle, if you're interested in preventing and reversing heart disease, check out the plant-based nutrition support group. You can find them online. You can check out Dr. Joel Kahn's website, drjoelkahn, KAHN.com. The other thing that I would encourage you to take a peek at and to visit is his restaurant. It's Green Space Cafe. This is in Ferndale, Michigan. It's a plant-based Whole Foods restaurant. The food is absolutely fantastic. It's probably my wife's favorite restaurant. She's gone vegan now. And so we've been there multiple times. And I said on the intro that Dr. Kahn actually hasn't heard yet, it's basically an explosion of flavors inside your mouth. So if you're the type that says, ooh, vegetarian or vegan, how can that taste good? The food is amazing. You're going to have a great meal that's going to taste, unbelievable. And the best part about it is you can eat pretty much anything there and not feel guilty afterwards because it's all good for you.
Appreciate that. I didn't know you had said all that. Thank you. But yes. We've worked very hard to create a laboratory of healthy, I call it, amazing food and drink that happens to be kind. It's kind to the body, kind to the planet, kind to the animals, but it is amazing food and drink. So thank you.
Especially if you're an animal lover like Joel and I are. That's the other part of it that's trying to avoid eating meat is just the fact that, these are animals. So let's kind of switch gears here to one of your newest projects, which I find really interesting. And what I'd like to do is start by showing a diagram here, and this will be on the video podcast. I'll explain what it is. But this diagram shows the size of various arteries in your body. We're going to go from right to left on this diagram. The right side is the right coronary artery, which is about 3 to 4 millimeters wide. The left circumflex artery, 3 to 4 millimeters wide. The left descending artery, 3 to 4 millimeters wide. And the penile artery, which is 1 to 2 millimeters wide.
Children are in the room. Cover their ears.
So how can actually the bedroom be a sign of heart disease?
Yeah, and it sure can. And it's a really important message. Sometimes we refer to this as the canary in the coal mine, but none of us are miners anymore. But there was a time that miners went into the mine with a canary in a cage, because if the canary plopped over dead, it meant the oxygen level was low or the carbon monoxide level was high, and they knew to get out right away. So the canary in the coal mine is an early warning sign, and we use that as colorful language. But it turns out that a man, we're talking about men right now, and come to my office. Do you get chest pain? Do you get short of breath? Do you ever dizzy? You ever black out? We run an EKG. All those things are fine. You kind of conclude, must have a pretty good heart. And then you ask that question. How's your sexual function? How's your erections? Do you need to use the blue pill? Do you have any difficulty in that area? Or you speak to the partner who might speak up earlier when there's both in the room. And it turns out that when that problem develops and when there's no obvious explanation, psychological or medicine interference side effect, that you may be identifying early blood vessel disease and 3 to 4 years before the chest pain, the heart attack, or maybe even a fatality. So the message is, the most important thing to take away from this, if you yourself are a male starting to experience erectile dysfunction, ED, or if your partner has begun to have it, bring it up. They need to know cholesterol, blood pressure, blood sugar in detail, and maybe a full cardiac evaluation using this canary in the coal mine clue. And it may be that it is just simply a smaller artery, as the diagram showed. So just a little bit of atherosclerosis and disease is going to impact blood flow there below the waist before it gets to the bigger arteries that affect the heart and even the brain and stroke potential.
So the idea basically is that when we're eating bad foods, when we're being unhealthy and we're getting this atherosclerosis, the body doesn't necessarily choose that, oh, we're going to do atherosclerosis just around the little vessels around the heart. You get atherosclerosis in all your blood vessels, basically.
Correct.
And the penile artery being one of the smallest but extremely important blood vessels in the body, that may be one of the first ones to start really constricting off. And if you can't get blood flow through there, well, that's where people start getting that erectile dysfunction. So it makes complete sense, although honestly, this is not something I've ever thought about or heard of until you started mentioning it. So it's really been an eye-opener for me.
Yeah, there's quite a bit of medical literature. There's a symposium called the Princeton University Symposium, and this is really what they focus on. But when you see your family doctor, even your urologist, are they going to bring it up? Not as often as they should. So a lot of soapboxes to stand on and kind of shout out, warning, warning. It is, and it remains, the number one killer. And every clue, premature balding on the head, turning white early in age, there's actually a little crease you can develop in your earlobe called a diagonal earlobe crease. It's probably loss of collagen structure in the ear, but it's become a very valid early warning sign that heart arteries may be clogged. Really? Turns out arteries are made of collagen, earlobes are made of collagen, and maybe a failure of the collagen in the earlobe that just happens to reflect a failure of the arterial collagen in the heart. So these early clues, but this bedroom clue is certainly one to go get all your numbers checked and find out what's going on.
So now we got to mention that you've got a new book called Vegan Sex.
You betcha.
And would love to hear what exactly is in this book. So you've written a book, Dr. Joel Kahn, America's Healthy Heart Doc Cardiologist, has written a book called Vegan Sex. What is in this?
So the subtitle is Dump Your Pills and Jump in Bed. And it's a healthy lifestyle book with a good sense of humor. I actually have two co-authors that we wrote it with. They're going to share, one of them wrote some amazing sexy recipes. And one is sharing her experiences as a woman, both married, divorced, dating it all, and kind of giving her own perspective on who can provide the goods in terms of their lifestyle and diet background, and bring it all together in a medical framework to say, canary in the coal mine, because it is preventable. I say put plants in your pants and you won't have this problem, but there's a little bit of humor. It's coming out in a few weeks. I think the cover alone will create a lot of interest in it.
Well, his name is Dr. Joel Kahn. You can find him at drjoelkahn.com, Kahn. He has written this book called Vegan Sex. He's also the best-selling author of several other books. So take a peek. The Whole Heart Solution is the big one that also was a public television special. Take a peek at his website. If you live or if you're going to visit Southeast Detroit, Metro Detroit, stop by his restaurant, Green Space Cafe in Ferndale, Michigan. You will not be disappointed. Even if you are a meat lover, this is definitely a place to go. You will find something that you like, and it's all good for you. So drjoelkahn.com, thank you so much for being on. I got one last question for you. And if we were to kind of leave our audience with one tip from Dr. Joel Kahn, America's Healthy Heart Doc, what would you like to tell them today?
Okay. So this will take about 2 minutes, but despite all our efforts to eat well, move well, sleep well, manage stress, avoid toxins, and live a clean life, we still are at risk of heart disease. And in every community where people are listening to this podcast, you have a hospital that offers a CAT scan of the heart called a coronary artery calcium CAT scan. Coronary artery calcium CAT scan. For about $100, you can go to the hospital, 1 minute, go home, and find out if you have silent heart disease. This is a critically important test when you're about 45, 48, 50 years old, maybe even 40 years old if you have what we call risk factors, high blood sugar, high blood pressure. And don't wait till you're sick and in the emergency room to find out if you have heart disease. Find out via this very simple screening test endorsed by the American College of Cardiology. But as you said earlier in our conversation, because it's inexpensive and there's really no profit in it, it's not promoted by primary care docs or hospitals the way it should be. If you want to watch something, watch a documentary called The Widowmaker Movie, which is all about the scan, how it got developed, how accurate it is, and find out for yourself. Find out if you're a 0, which means the best score, clean arteries, and then you really have confidence that you're on the right path, because it's a very complex process. So that's the final parting shot. Test, don't guess. Test, don't guess. Find out what's going on.
Does insurance usually cover that?
You know, in Texas, every citizen has it as a covered benefit for every insurance, even the uninsured. So the answer is there, it's free. In most states, you're going to pay currently $75 to $150, sometimes less. That's far less than it was 10 years ago.
Oh, yeah. Yeah. And for your health, I mean, $7,500, what can you do? Well, thank you so much for coming on. It was definitely a pleasure. I'd love to have you back on. There's so many other things that I think we can discuss and get into. We only really hit probably half the stuff I wanted to today. So we'll definitely have you come back. I'm Dr. Anthony Youn. Thank you. America's Holistic Plastic Surgeon. This is the Holistic Plastic Surgery Show. We'll see you next time. Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I spent the past 17 years learning the secrets to turning back the clock and have written all the best of these secrets in this book. This includes the Age Fix Diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is. From age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out The Age Fix. Now, if you purchase it on my website, dryoun.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making The Age Fix such a huge success.